What is the number one reason parents have difficulty with consistent follow through? And that's ambivalence. So let's talk about ambivalence. There are always two sides. And if we don't own both sides, then one side goes underground. So for me, exploring ambivalence is the therapeutic or the clinical aspect of Back to Basics. It's why we have the MSW or the LCSW. So Reevah taught that telling is not therapy because telling people what to do doesn't work. We can't tell caregivers what they're supposed to think and do, but through questioning, through examining, through assessing, we may lead them to different thoughts, to think, to see, to understand differently. So then our conversations with parents become a process of helping caregivers to think things through. So we can explore client beliefs in a non-judgmental way through structured questions that clarify ambivalence and undermine the ideas that prevent parents from changing their child's behavior. So I'm going to offer two questions that you can use to explore parental ambivalence. So one question is, what are your ideas about why your child behaves this way? And the second question is, did you want to raise or discipline your kids differently from the way you were raised? And of course, I'm always going to throw in the $1 million question, which is, what's the $1 million question? What are your fears, worries, doubts, questions, or concerns about making that rule for your child? Okay, so let's talk about the first question. What are your ideas as to why your child is behaving this way? So some parents will say, I have no idea, but it's within our nature as human beings to come up with a theory or an explanation. It gives us a sense of control over what's happening, that life is predictable. So if people say they don't have any ideas, it might be that they're embarrassed and don't want to reveal their thoughts to us. So what you might say is something like, I understand it's just an idea and you don't really know, but this behavior has been going on for some time and I'm sure you've thought about it. So this reassures them that whatever they say is acceptable. You're not judging them on their answer. So also by asking parents, what are your ideas as to why your child is behaving this way? We'll see that the ideas they offer imply the child is either unable to follow the rule that you set or is justified in not following the rule. This is the heart of ambivalence. Parents want the child to do something, but in their heart of hearts, they feel the child is unable or justified in not doing it. That's the ambivalence. They feel that the child has a really good reason for not following the rule, and the parent agrees with their reason. So we ask questions that reveal to parents what their ambivalence is and how it prevents them from consistently following through with their rules. Okay, so there's a question about the slide. So the slides you're going to see are common ideas that parents have. What I'm talking about is questions that you can ask to get at these ideas. And in Schoology, there's a Resilient Families Manual. And in session 7, you'll see the lesson and you'll see facilitator handouts. And so there you'll see these questions and there you'll see the list of common ideas that parents have, okay? So you have this information, or you'll have this information. Okay, so back to ambivalence. So parents only have problems with changing child behaviors that they feel ambivalent about. Ongoing conflict suggests underlying agreement, or else parents would put a stop to it. So let me give you an example. So I talked to a mother of a teenage son who would do chores around the house, like throw out the trash, even wash dishes, okay, a couple times a week, but he wouldn't go to school. So I asked her, how did you get him to do that? Like, how did you teach him to like throw out the trash and to wash the dishes? And what I was trying to do was point out that she did have the ability to enforce a rule. So I'd ask her, what did you do? How did you accomplish that? And she would say, well, I stand in the kitchen while he's washing the dishes and I don't leave until he's done. So clearly mom is not ambivalent about chores, but she is ambivalent about school attendance. So I asked her, what was it like for you? What was your school experience like? And what did your parents do? So the second question is, did you want to raise your kids or discipline your kids differently from the way you were raised? And so for some parents, the idea of discipline sounds harsh or abusive. And parents who were physically or emotionally abused may confuse discipline with abuse. And so they bend over backwards to avoid setting limits for their children. Like they go in the opposite direction. And this leaves a power gap that the children fill by assuming authority over and sometimes against their parents. Parents treat children as parents wish they would have been treated. In order to avoid being a victimizer as a parent, because their parents might have victimized them, parents are willing to be the victim to their children. I'll give you an example. A parent said, when my 14-year-old son yells at me, suddenly I become 5 years old and it's my father yelling at me. So we take mom from what was real at one point in her life, then and there, being a helpless 5-year-old, and we take her to where she is today, in the here and now, a capable adult with resources. Common ideas that parents have about why children are behaving the way they are. Some of them include, I don't want to make my child unhappy. Love is never making your child unhappy. Or I didn't like it when my mom told me what to do, and so I don't want my child to be unhappy when I tell her what to do. So some of these things, I'm afraid I can't control my behavior when I get angry. I feel sorry for my child because of everything that's happened to our family or to my child. Partner or my co-parent doesn't support me. I'm too tired to supervise. So these are all common ideas that parents may have. So I don't want my child to be unhappy. Does the parent equate love with getting what they want? If I love my children, I will give them whatever they want. In return, if he loves me or they love me, they'll always do what I want in order to please me. In essence, they've changed the subject from discipline to how much do you love me? But it's a one-sided contract and the child has not agreed to it, and so the parent is disappointed. But I would caution you that when parents disclose or share their ideas, I don't want my child to be unhappy, I'm afraid I can't control my behavior when I get angry, I feel sorry for my child. The trick is not to reason with them, because you can't reason with fear or beliefs. And remember, reasoning is like telling. So telling is not therapy. And so what you're going to do is you're going to ask questions instead to help them think it through. If a parent says, I don't want my child to be unhappy, what would you ask? You wouldn't say like, oh, well, is it your job to make your child happy? Like, you wouldn't say that. That would not work. That would not be an effective intervention. But so if a parent said, I don't want my child to be unhappy, what would your intervention be? What would you ask? Were you happy at his age? Okay. What would it mean for your child to be happy? What does unhappy look like? What do you mean? Tell me more. Yeah, so curiosity, exploration, beautiful. I love it. All right, let's try another one. So let's say a parent says, I'm afraid I can't control my behavior when I get angry. What would be your intervention? Okay, what fears do you have about not being in control? Tell me more. What are your fears? What's the worst thing you think you would do? Have you ever lost control? What are you afraid you might do? What does that look like? Beautiful, beautiful. Okay, let's try another one. I feel sorry for my child because they haven't seen their other parent in over a year. And so I feel sorry for my child. It's hard for me to get them to do their schoolwork because they haven't seen their other parent in over a year. So how would you intervene? What's that situation been like for you? Has your child said anything to you about that? Have you talked to your child about your concerns? Tell me more about that. You guys are freaking awesome. I love it. I'm gonna write some index cards right now before I forget. I'm not even waiting for the chat to download. I love it. This is a good one. My partner or my co-parent doesn't support me. How would you respond to that? Let's talk about that. How does this impact you and make your child feel? Can you elaborate? What does support look like for you? So to me, therapy is all about helping clients accomplish their goal. When somebody is complaining, my parent, my partner, my co-parent doesn't support me, that's a complaint, that's not a goal. So I would want to know, well, what do you want? And so when you get that response, now the parent is developing a goal that they can work towards. Well, I want us to agree on the rules and back each other up. So there's the parent goal. And how can we make that happen? How confident are you that you can make that happen, that you can have that conversation? Okay, what does support look like for you? How would their support benefit you? Lovely. Finally, there's the idea, parent idea, I'm too tired to supervise. So how would you address that? The parent says, when you say, what are your ideas about why your child behaves this way? The parent just comes clean. I'm too tired to supervise. So how would you address that? Validate. What will happen if you don't supervise? Great question, but a punch right to the heart. That makes sense, validating. What else is making you tired? Do you have someone who can support you at times? Tell me about your support network. These are beautiful questions. I'm sending Hershey's kisses to you. I can understand that. How can you get some support? Beautiful. So let me get back to ambivalence by sharing with you quickly another story that actually Reevah shared with me about it. So this was Reevah's advice to me about parenting. And this was even before I was pregnant, before I even had a child. So she looks at me because, so I have to tell you, so I started with school mental health as a PSW in January of 1998. And I didn't have clinical supervision until December of 1998. And so there was a whole year where I was like a chicken with my head cut off, just trying to figure it out. And so when I finally got to Reevah, I was like, I'm so thirsty. Like she was like oasis. But anyway, so she says to me, what kind of kid were you? And I was like, what are you talking about? I was a dutiful kid. She said, be careful. There's gonna be a part of you that admires your child's rebellious attitude against authority. You're gonna admire her attitude because you're gonna wish that you had been that way. And you'll want to align with her against authority. Except now, that authority is you. I'm so grateful to Reevah for that heads up, because I did not want to be subconsciously undermining my own authority with my daughter. And when I say authority, I mean the judicious use of my authority and not abuse of authority. To me, there's a difference, a big difference, which I'm not ambivalent about. Firm, fair, and caring. That is the balance I aimed to strike in raising my daughter. In fact, you saw my daughter in the video that we did together. And she said to me, Mom, do kids really talk to their parents that way? Because it wasn't my lived experience. My mom was, I told you, she was an immigrant from northern Mexico, and there is no way. And so in raising my own daughter, I was like, first of all, you do not talk to me that way. That is not okay. So another question to explore ambivalence might include saying something like, it feels like there's something else going on, parent, caregiver. You know what to do, you know how to do it, you're able to get your children to do X, Y, and Z, throw out the trash, wash the dishes. And there's what you say you want him to go to school. So there must be a good reason why you don't make him go to school, why you don't make the changes. So for the practitioner, the hard part about exploring ambivalence is that we must question our own assumptions. So I've got a question for you. What fears, worries, doubts, questions, concerns do you have about exploring parental ambivalence? What is your ambivalence about ambivalence? Afraid to say the wrong thing because I don't have a child. Thank you. Offending the parent. not having parent models to follow, inadequacy, judging parents who are limited in resources. I'm not a parent, so I really don't know. I will say that before I had my daughter's 19 now, my pride and joy, the apple of my eye. But before I had her, when parents would ask me, are you a mom? Do you have kids? Like I was so clueless. Like they weren't asking about my credentials. They were asking about my empathy. They wanted to know, have you been to that dark place where you could just throw your kid out the window, but you don't, but you could, but you don't? Have you been to that dark place? And will you judge me for it, or will you empathize? So I think that's most important. I think that if you can empathize, you don't have to have the same experience. You don't have to have a family member who suicided. You don't have to be a recovering drug user in order to connect. I think that you are empathic, perceptive, caring, genuine, non-judgmental professionals. How would you answer the parent? I think after I had my daughter, I would just look knowingly into their eyes and be like, I hear you. I know what you're saying. So I hate answering a question with a question, I really do. But personally, I might say, I feel like what you really want to know is, well, I get it. Well, I understand you. These are my last 3 points. Another thing I wanted to mention is the whole family is the client. The children see the world the way the parents do. All this does is indicate that caregivers have a problem. And it's not a problem to have a problem. There's no shame in it. We all have them. So how do we help parents be the adults that their children need? Because not being contained is its own trauma. Children need to feel that a caregiver can be the bigger person and help them regulate their behavior. So one mentor, Jolene Swain, she taught me that adults need to learn how to bind their own anxiety. How do parents learn to self-regulate so they can make better decisions? Because nobody's at their best when we're stressed. How do we self-regulate so we can make the best decisions? Because we have the most freaking important job in the world, taking care of kids. Second mentor, Rose, who I already mentioned, she mentioned that we all need to learn how to grieve. And I don't just mean grieving death, although that's included, but all sorts of loss. Think about how many losses that we are grieving and mourning right now, or that we're experiencing but may not be grieving or mourning. And then finally, Reevah, she said, when parents are adults and have good relationships with other adults, including their partners, the message that sends to their children is that they're not dependent on their children. And so this frees their children to grow up. Other common ideas that parents have is, I must be physically present with my child in order to manage their behavior. So they feel like they can't change classroom behavior because they're not there, in which case we used to use parent-child communication like a daily homeschool report. If I can't hit them, there's nothing I can do. So parents are literally saying like, listen, my parents used physical discipline with me. If I can't do that with my children, then I'm out of ideas. That's all I know. Punishment is more important than changing their behavior. Sometimes parents let things slide so long that they are so angry, resentful, bitter, and they're like, okay, forget it. I don't care that today you woke up and want to follow the rules. Man, I just want to punish you for the last, few weeks or months. I want my child to be happier than I was. And discipline kills creativity and fun. So I already know from your interventions in the chat that you have some ideas about how to address this through your curiosity, through your empathy, through your exploration.